Greetings, and welcome to Lobes and Robes, How Neuroscience Can Change the World. This podcast is sponsored by the American University Center for Neuroscience and Behavior and explores the links between neuroscience and key policy questions. I'm Colin Saldana, a professor of neuroscience and the director of the Center for Neuroscience and Behavior. My co-host is Dr. Gustavo Ribeiro, associate professor of law at Washington College of Law, American University. This podcast is for anyone interested in how scientific discovery can make the world a better place. Thank you for listening.
Our guest today is Dr. Professor Sundby. He's an assistant professor at the University of Tennessee Whitson College of Law, where he teaches criminal law, evidence, and law and neuroscience. He also holds a joint appointment in the Department of Psychology and Neuroscience at the University of Tennessee. His scholarship employs empirical and scientific methods to legal questions, such as what neuroscience can tell us about the accuracy of psychological assumptions embedded in several procedure rules, like our rules of evidence and other criminal procedure rules. Professor Sundby earned his JD and PhD in neuroscience from Vanderbilt University. He's a perfect person for us to talk to about the interaction between law and neuroscience, and we're very, very happy to have him. Welcome, Christopher.
Well, thank you so much, Gustavo, for that introduction. And it's really an honor and a privilege to be here with you and you as well, Colin. And I'm looking forward to our conversation.
Terrific. Now, as I mentioned, Chris, you've written a lot about how neuroscience can offer a new set of lenses for testing some of the psychological assumptions that often go unspoken that underlie many of our rules of evidence or rules of procedure. What first you drew to that intersection?
Yeah, it really goes back to taking evidence class in law school. I was a dual degree student, so I was pursuing my PhD in neuroscience concurrently. And as a student in class, the rules of evidence seemed like one of the most Byzantine sets of rules in the legal world. But I also came to realize that it is, in many ways, the machinery of the entire legal system and cuts across many different legal fields. So studying whether this machinery is producing the results we want, and if it is doing so efficiently and effectively, is a really valuable research area. And importantly, the machinery is largely designed on psychological assumptions. So in other words, a lot of attention has been paid to jury and judicial decision-making, and rightly so. But even if we have optimal evidence and perfect decision makers, we are still going to get suboptimal outcomes if we aren't getting the evidence to those decision makers in the correct form. And as my understanding of evidence law grew, I came to understand that there's been a lot of debate over whether the rules of evidence are too stagnant, particularly with a focus on incorporating research from the social sciences to modernize the psychological assumptions inherent to the rules. So my research is really meant to demonstrate that neuroscience has an important role in this discussion, and that improving our understanding of the underlying cognitive realities can lead to greater insight into the rules and potentially, and hopefully, how best to reform them for some more accurate outcomes.
That's terrific. That's music to my ears. I share the same interests and write about similar things and tell my students similar things. So it's so great to have someone doing great work to carry that agenda. Now, on the topic of law and neuroscience, there's a sense in which for a lot of people, law and neuroscience or neuro law is still associated with flashy fMRI lie detection or other forms of instruments. Your work takes a much more structural approach, examining as you mentioned, as you was describing to us, the assumptions and the design of some procedure rules. How do you think that shift the conversation about, what neuro law or neuroscience can offer to law?
So, to be clear, I'm really glad that there are people out there working on fMRI lie detection and improved tools for detecting brain injuries and any other number of case-specific applications.
Right.
But I think where neuroscience can be most helpful in the short to medium term is in shaping procedural rules. And this is because of what the literature refers to as the group to individual problem. Neuroscience and the social sciences primarily study group and population averages. But this is limited utility and telling us whether that average is true in any particular case or situation. But procedural rules are all about designing rules to the group or average case. So procedural rules are an area where neuroscience can potentially have a more immediate impact.
That makes so much sense. In our field, just like you mentioned, it's all about averages and standard errors of the mean. And so it's very uninformative about individuals in the population itself. If I may focus on your recent paper on the present sense impression rule, to people like me, to non-lawyers, the present sense impression rule may not sound very glamorous. In fact, I would like you to explain it a little bit. But your paper suggests that it's a perfect case study. Why is that? And I have a follow-up question after that.
First of all, I'm just blown away by the idea that the present sense impression doesn't sound glamorous. I wish I had been on here years ago. I've already spent years studying it. So, I wish I had gotten that insight earlier. But no, jokes aside, that's obviously a very understandable sentiment. And I'm sure one that is shared by many. But the PSI, which is what I'm going to call the present sense impression, so that I don't spend the whole podcast just repeating those three words, does have several clear advantages as a case study. I think first and most importantly, the advisory committee notes make explicitly clear that it is premised on specific psychological assumptions. And these are psychological assumptions that are testable with behavioral and electroencephalogram or EEG measures. So as you said, it kind of provides some context on the PSI. We have this general framework where hearsay evidence is excluded because we believe it is unreliable. And we believe that because it doesn't undergo the traditional trial safeguards of the oath and cross-examination. But we also have this hodgepodge of exceptions that have arisen over time when we believe the hearsay evidence to be more reliable. The problem is these exceptions are primarily based on folk psychology and assumptions of, to be kind, dubious empirical validity. So my paper presents the results of 2 empirical studies using behavioral and brain scan measures, which tests the psychological assumptions behind the PSI, which, to be explicit, the PSI assumes that statements made, quote, substantially contemporaneously with the observed event are more reliable because there is a reduced risk of memory errors and because there literally is not time to lie. And courts have really struggled to define what is substantially contemporaneous, with courts varying from 30 seconds all the way up to 23 minutes and everything in between.
Wow. So you've used neuroscience methods to see how people lie about contemporaneous versus past events. Your results indicate that contemporaneous versus delayed statements involve different cognitive strategies, with the switch occurring remarkably fast, like within 3 seconds. What did the data reveal about how lying changes with time?
Yeah. So, the results of my studies suggest that contemporaneity does, in fact, offer some degree of protection against deceit. Specifically, people lied about 9% less when responding in the moment compared to after a delay. And like you said, I also found that people engage cognitively distinct processes when lying in the moment versus after a delay. And my primary brain scan measure was an event-related potential called the contralateral delay activity, or CDA, which essentially measures how many items a person is holding in working memory. And so we measured the CDA during the time period between when the participants were shown the stimuli that they were going to lie about and when they produced the lie. And what we found was that when they were given more time to prepare their lie, but by more time, I quite literally mean 3 seconds, they employ a cognitive strategy where they actually lower their working memory load. So in other words, they seem to be dropping information from working memory. And based on our behavioral measures, we know they aren't dropping the lie from working memory. So they are likely dropping the truth from working memory. So this allows them to lie quicker and potentially reduce behavioral tells, but it may come at a cost to their memory for the truth of the stimuli they lied about, which, if that bears out in more ecologically valid settings, would be something that could be exposed by effective cross-examination.
Wow. So were you surprised with the direction of that result? As a psychologist myself, I would have guessed that lying takes more items in working memory than just telling the truth. the old story about how you have to juggle so many things you've made up in order to keep the lie going. So were you surprised that people actually dropped working memory load when they were lying?
Very much so. So, I was definitely expecting to see an increase in CDA, and, almost every model of lie generation hypothesizes that there's this period where you're holding two versions of the event and working memory. And so I was very much expecting an increase. And so this was an unexpected result, but, I think it also makes some sense in that by dropping one of the representations, you're going to reduce your cognitive dissonance, which is going to make it easier to produce the lie.
That does make sense.
So 3 seconds should be the golden rule?
So yeah, I think the easiest rule is to just disregard the substantially contemporaneous and make the PSI limited to truly contemporaneous. And in many ways, I think this is actually an easier to administer rule than the substantially contemporaneous version. And it also removes the biggest source of inconsistency in the rule's application when judges are struggling to define what substantially contemporaneous is. So I actually view that as one of the biggest advantages of my proposal. Now, admittedly, this would reduce potentially significantly the number of situations where the PSI would apply, but there are still clear circumstances in cases where it would apply. And then there's another hearsay exception called the excited utterance, which would largely pick up the slack. So, now we just need to test the psychological assumptions behind the excited utterance.
Right. An even more glamorous exception.
Exactly.
It's fascinating. You talk also a little bit in your research how there's still the issue of habitual, I guess, or repetitive liars, that those findings might not apply in such a clear-cut fashion. Can you tell a little bit more like what you found, those like an exception, and do we have any other procedure or that we can design in course, or does neuroscience tell us a little bit how to treat those individuals?
Yeah, so, I think that primarily refers to actually the reduced emotional impact of repeat liars. Unshockingly, mine is not the first paper to delve into trying to apply, established neuroscience research to the PSI. And one of those papers that was very well done found that the typical emotional salience of lying reduced with frequent liars. And the problem with that then is that the PSI then may be true for most individuals, but it's not going to be true for a subset. And what we need to assess about the individual in determining whether they belong in that smaller subset, we would really want them to be brought into court and, assess their credibility. And so it actually makes it poorly suited as a hearsay exception. I think the CDA, which is a working memory measure, it's a great question. We should empirically test whether repeat liars are perhaps able to engage this alternative strategy more quickly, but I think it's less likely to be sensitive to the frequency of lying than measures that look to the emotional salience of lying.
Very interesting. Now, in a sense, then, it feels like, and you mentioned this in the paper, that it seems like the rule makers here in designing the present sense impression have almost like looked into a rule that happens to fit with some neuroscience evidence. They might have used the wrong words in explaining how courts should apply their rule. We can talk about contemporaneously or truly contemporaneously or substantially contemporaneously. But they do seem to have looked into a rule that at least research seems to suggest the empirical assumptions behind it are not completely off the mark. What do you think that tells us about the relationship between, laws, focus, or at least reliance for the most part on intuitive and folk psychology and empirical psychology?
It's a really great question. And I think it in many ways highlights the fact that we, and maybe this is a reminder more specific to me, should not assume that a psychological assumption is wrong just because it is empirically untested. A lot of human behavior is intuitive, and there is wisdom to be garnered through experience. That said, given the importance of these psychological assumptions, the importance they play in our legal system, I also don't believe this relieves us of the responsibility to use every single tool that we have. to assess the accuracy of these psychological assumptions, and whether that tool be based on experience or empirical behavioral studies and measures or brain scan measures.
Right, that's fascinating. It feels like researchers like you have your work cut out for you to go about and testing all those assumptions.
It's exactly what I was thinking as well. So we talked about the PSI rule, and we just mentioned folk psychological assumptions and how they impact several evidence rules. Beyond the PSI rule, though, what are some other evidentiary rules or doctrines that you think could be helped by neuroscience?
Yeah, so I think this is also a really good opportunity to point out that there are a lot of amazingly talented scholars doing important work in this area. And I hope that this research fits into a long line of empirical research and testing of the evidence rules. This includes work done by Jeffrey Bellin, Justin Severe, Stephen Friedland, Amy Overman, Heidi Liu, Susan Bandes, and Jessica Salerno, just to name a few. But I think some of the next targets on my list are testing the assumptions behind the excited utterance hearsay exception, which is unsurprising given some of our earlier conversation. And this is very intertwined with the PSI. So I think it's important to test this so that my research can have a real on the ground impact. I'm also interested in a broader reform of the hearsay rule, combining my work with some work done by Justin Severe, showing that juries can properly discount hearsay evidence. So this may take the form of, an inverted hearsay rule. And, there's also no shortage of projects outside of the hearsay rule. For example, there's been a lot of criticism, and I would say appropriately so, of limiting instructions. When a judge instructs a jury to use evidence for one purpose, but not for another. And, assuming the limiting instructions are here to stay, at least in some form or another, I'm interested in whether neuroscience can offer some alternatives to make them more effective.
That's great. That's a growing list of people who want to reform the hearsay rule, including every law student who has to spend weeks grappling with it. But that's terrific.
Except for my students, who it's just crystal clear to from the beginning.
I should be saying to some students. Now, you start off talking about the group to individual problem, which seems like it's something that first sparked your interest in all the discussion and a lot of it, this literature. Going back to it, do you think that neuroscience will ever help us bridge that gap between inferences as to groups and inferences as to individuals, or is that just an inherent limit in nature or reasoning that law must just manage?
Yeah, so it's another great question, and I think it's likely a problem that is here to stay in some form or another. But I do think that the gap will shrink as we get more and more tailored and nuanced understandings of the group. So, in other words, as our understanding of the conditions that create a group average improves, we can create tighter and more specific groups and better understand the exceptions and outliers. But ultimately, there likely will always be a gap. But I also want to point out that this is true of many forms of evidence. And, I think neuroscience evidence in specific cases is best thought of as what's called framework evidence, or evidence that bears on the likelihood of a fact being true based on the defendant's membership in a particular group. And this is an idea that's been largely developed and built on by David Fagman, Neil Brown, and Aaron Murphy, among others. And, I think neuroscience evidence can be extremely useful in specific case applications in this framework evidence role.
I think that's a great answer.
I don't often get that, so I appreciate it.
No, it's interesting. I think I agree with that. Now, on that note, you also argued that how neuroscience can help us make a lot of our rules of evidence and other procedure rules more empirically grounded, right? Now, this is something I keep thinking myself, like, when is an empirical finding strong enough to justify a change in law or legal practice? Like, you're very cautious in your writing about saying how, law, the norms are also aggregation of values and different policies. So it's hard to say that neuroscience would just dictate what the law should be. But how strong an empirical finding needs to be for scientists or academics to feel confident enough that they can, in good faith, recommend a rule change to rule makers? Do you have any views on that?
Yeah, I mean, that's obviously a very difficult question. And I think there are really two parts to it. The first is, when is there enough empirical evidence to reconsider the underlying psychological assumption? And there is no firm answer to that. I think good empirical work in this area really builds a bridge from very controlled laboratory settings to more and more ecologically valid settings so that we can be more confident in the generalizability of the findings. And then, of course, we need replication of those results across different settings and different labs. But when exactly there is enough evidence, I think also will depend on the strength of the evidence underlying the original assumption. I think it takes less when the original assumption is based on simply intuitive psychology compared to when there are empirical findings going the other way as well. Now, more broadly, I don't think an empirical finding in and of itself is ever enough on its own to change policy. Rules and praxis are based on more than just these psychological assumptions and are really value judgments that are trying to balance competing interests in the legal system. So, for example, there may be reasons to keep the PSI in its current form, despite its empirical shortcomings. And, I think the issue is when policymakers are using faulty assumptions, they may not be striking the balance that they think they are, but the ultimate decision of where that balance point is on any given issue is something that I think we have to decide as a society and a legal system, and isn't, a scientific question per se.
Right. Your work talks a lot about the role of legitimacy and what those, empirical research can tell us about views on legitimacy by the public or by certain professional classes. But the legitimacy has been another big value besides just psychological accuracy or scientific accuracy that the law should or does constantly strive to achieve. So our work is very hard, Colin, as attorneys. Very, very hard. Moving to one of your other papers, particularly the one that I think with the title, The Right to Personality, the fascinating piece, where you actually talk about a very different topic, like forced medical interventions in our criminal justice system, a very, very sensitive topic, very important topic. What led you to write about that specific topic?
Yeah, so it really came about when I learned that a significant minority of states allow for the chemical castration of sex offenders. And I was just, quite frankly, pretty darn shocked to learn that, right? And so, this struck me, quite frankly, as just clearly wrong. But there were also some articles where some of the individuals who had received the chemical castration talked about how they felt free for the first time from these obtrusive thoughts and impulses. And it was the first time they felt free in their lives. And as I thought more about it, I started thinking more and more about, what really is the difference between therapy and medication. At the end of the day, if therapy is effective, it is having an effect in the brain. And so, there may not be as clean of a distinction between the two as we intuitively believe. And yet we have no problem with courts ordering anger therapy, for example. And I then came across some studies finding that 5-HT1 agonists in rats reduced aggressive tendencies when a new cage mate was introduced. Some other studies finding similar results with deep brain stimulation. And it made me think about the possibility that some of these interventions have the potential to actually create a more rehabilitative justice system. So I became very interested in how the legal system should try to, very much protect against interventions that infringe too much on liberty interests, either in the state assessment of what is a good or bad trait, or that may become, the next frontal lobe lobotomy, but also still leaves open the possibility that some behavioral, neurological, and pharmaceutical innovations may reduce the need for imprisonment and allow people to better function in society.
So one of the things that you propose is a personality integrity test to limit the appropriateness of these types of interventions. Can you walk us through what that test looks like and how it differs from current constitutional approaches to forced medication?
Of course. And let me talk about the current approach first. So the current jurisprudence has evolved in the context of the forced administration of antipsychotics, most notably in the two Supreme Court cases, Washington v. Harper and Selby, United States. And the Supreme Court in these cases recognized a liberty interest in refusing medication, but held that this could be properly overridden in certain situations. And the Harper-Cell framework focuses on the degree of the state interest, both in protecting the public and in treating the individual, and on medical appropriateness, with a particular and really almost exclusive focus.
Yes.
Exactly. On if the individual has a clinically diagnosed mental illness and on the physical side effects of the medication. So I think this framework really does not fit well with the types of behavioral, neurological, and pharmaceutical innovations that courts are going to have to assess in the future. It is simultaneously both too broad and too narrow. It will fail to adequately protect against side effects that are not physical. These include changes in thought and personality, but it also fails to acknowledge the possible benefit to individuals who do not have a clinical diagnosis, and so for whom these interventions would never be, quote, medically appropriate, at least in the traditional sense. Lowering aggressive tendencies is not something you normally see a doctor for, and much less receive a clinical diagnosis. So, I really felt that there was a need to develop a new framework that properly addresses the concerns that these new interventions will raise.
That brings up an associated question that I have, which is there are some times when people for, let's just say, substance use disorders, there's plenty of evidence that some substance use disorder patients resist treatment. But if they are forced to be treated, sometimes they're somewhat grateful. How should we think about these findings into your personal integrity framework without eroding autonomy?
That is a remarkably difficult question, and one that I think philosophy, psychology, and the law has struggled with for a really long time and has yet to come up with the perfect answer. And I certainly am not claiming to have. That said, my proposed test tries to avoid subjective judgments of what is someone's true personality, and instead would focus on the degree of state interest, which here would incorporate the type of drug being abused and any accompanying behavior, as well as the type of coerced intervention being employed, with a distinct preference for interventions that try to target response level attributes as opposed to higher level personality traits. So for alcohol, this could be something like antabuse, and the test would favor that drug to a drug that has a more diffuse effect on impulse control. And then for more traditional behavioral interventions, this, for example, may mean favoring a secular 12-step program as opposed to a religiously based program like a traditional Alcoholics Anonymous. So, these lines are going to be difficult to draw in practice, both scientifically and morally, but I do think it's an improvement on what we are currently focusing on.
So one of your concerns is avoiding what you call the medicalization of crime. What does that danger look like in practice as neuroscience-based interventions become more common?
Yeah, so Stephen Morse, who I certainly don't agree with on everything, but him and others have raised a lot of important questions in this area. On the one hand, an increased focus on medicalizing can invite a more rehabilitative approach to crime that has the potential to be beneficial, both in potentially lowering recidivism rates and being a more benevolent and less retributive system. But, the core of the problem and the concern is that if you medicalize social problems, you are inherently granting the state power to fix the problem. And that invites state overreach, and the state may not be the best suited to fix these problems. And, it invites problematic social engineering. And, history is unfortunately chock full of past warnings on this front.
Now, it feels like that's such a fascinating discussion, so important. That gets to a point that seems very consistent throughout both papers that we discussed today. There's a theme of humility here, that law, be it our criminal justice system, rules of evidence, shouldn't just rush to adopt either neuroscience or other forms of scientific findings or reasonings, but of course shouldn't ignore it either, should strive to get more people like you doing the great work of elucidating what's really going on. How do you think courts, and we're trusting Congress and rulemakers and even attorneys, can strike that balance between, not rushing to adopt science teaches, but not ignoring it either.
Yeah, I'm really glad that you picked up on that, because I think it really is a tough line to walk, and one that I struggle with in my own scholarship, and balancing, my enthusiasm for some of the promise of neuroscience to improve the legal system with those past warnings of when the law has adopted science that is clearly not ready. And it's an even tougher line for courts to walk. And ultimately, I actually think a lot of that responsibility falls on us as academics and on experts in the field to make a conscious effort to responsibly publicize their research and scholarship, both its advantages and shortcomings, and to engage in outreach with the legal community. And, I think your guys' podcast is a great example of this. And also, the MacArthur Network on Law and Neuroscience has offered training sessions on neuroscience evidence to judges. And I think that's a really important part of it, as well as rejecting kind of just a wholesale dichotomy of either it's ready or it's not. I think a good example of this, at least when it's properly done, is when courts limit the conclusions an expert witness can draw from their findings rather than wholesale excluding the testimony.
Or allow it in, which might be even worse.
Right. No, absolutely.
Yeah. Well, you heard it here first, folks. All federal and state judges in the country should be listening to the podcast.
I think it's a great idea, Gustavo.
And reading Chris's work, for sure.
So, Chris, if you, just to sort of round this out, if you could design a next generation law and neuroscience research agenda, what questions would you prioritize? What needs to happen?
Well, first of all, that definitely sounds like a grant proposal I need to write.
Nice.
And I think I would break it down into sections. So looking at pre-trial legal issues, I think this could include things like how to gather eyewitness testimony, policing practices and policies, including interrogations and what types of officers we have on patrol. And, how could we engage tools such as guilty knowledge tests and other investigatory tools, as well as more investigation into neuroprivacy issues that may be implicated by investigation. During trial, I think it has a role in looking at the traits of the defendants, age of majority, and how do we treat young adult offenders? How do we define legal insanity? And can it help us provide insight into mens rea? It obviously can help in forms of evidence, establishing a framework for separating wheat from the chaff, while also developing better evidence, for new methods for assessing pain and brain injuries. It can help us with witnesses, with that flashy fMRI and other neuro-based lie detection, as well as, I think an interesting issue is how does witness preparation affect or contaminate their testimony? And also legal decision makers, judges and juries, right? Improving our understanding of punishment decision making and how we can improve it. This would also include, I think, polling from educational neuroscience on how trials should be changed to improve comprehension and retention and how to limit bias, developing a better understanding of how legal decision makers process evidence and how instructions and expertise may change this. And then briefly moving post-trial, I think understanding the effects of punishments, such as solitary confinement and the long-term effects that can have. And it also has potential, I think, for, improved recidivism prediction.
That was a very, very nice path analysis. Thank you.
That's such a great list that can fill many, many careers worth of research agenda and grants, for that matter. Well, Chris, I want to thank you so much for taking the time to talk to us about this important set of topics and your fascinating research and teaching us and reminding us about keeping a humility about what the limits of our knowledge, about what we may not know, but yet instilling us the curiosity to try to answer new questions.
Thank you, Chris.
Thank you so much.
Thank you, guys. I really appreciate this and have enjoyed it.
Thank you for listening to Lobes and Robes, How Neuroscience Can Change the World. This podcast is produced as a partnership between American University's Center for Neuroscience and Behavior and the Washington College of Law. If you'd like to reach us, you can email lobesandrobes at american.edu. You can also find us on LinkedIn, Instagram, and YouTube for updates and additional content. If you enjoy the show, please consider subscribing and sharing it with others. We look forward to having you with us the next time.
This podcast was edited by Resonate Recordings.